Hello, everyone. Welcome. It's my pleasure to welcome you to this webinar. I'm Rita Francisco. I'm a survey manager at EURORDIS with the Rare Barometer Team. I'm joined here today by my colleagues, Jessie Dubieff, Fatoumata Faye, Jessica Bello, and also by our colleague, Gulcin Gumus, who is our Research and Policy Senior Manager. The webinar is going to start very soon, but before I give the floor to Jessie, I'd like to share some housekeeping rules. These are quite simple, but they are also very important. So I would like you to please keep your microphones muted when you're not speaking. So unless you have a question or you'd like to share a comment with us, and before you do speak up and unmute yourself, make sure to first activate the raise hand feature that you're going to find at the bottom of your screen in the Zoom menu if you want to ask a question or share a comment with all of us. Also, feel free to keep your camera on or off. It's really as you prefer, whatever makes you feel more comfortable. As you know, we are recording this webinar, so we really want you to feel at ease. And also, we really want to get to know you better, so please feel free to use the chat to introduce yourself, like some of you have already started to do. So please tell us the name of your organization or the rare diseases you represent or work on, as well as from where you're joining us today. And of course, feel free to ask any questions, make any comments throughout the entire webinar. We're going to be keeping an eye out in the chat so that we can address all your questions during today's webinar. And without further ado, I would give the floor to Jessie so that she can introduce today's webinar. Thank you.
Thank you, Rita. So welcome, everyone. I'm very happy to be hosting this webinar to present the results of the newborn screening survey that we have run last year and that we will be all presenting today. So just an overview of what we will be talking about. We will give again some context, updated context on newborn screening, on the Screen for Care project, and on Rare Barometer for those who don't know us. We will dig into the key findings of the survey. We will also tell you what EURORDIS will provide in terms of survey results on our website and available to everyone, and also what we will provide to the EURORDIS members in terms of tailored results, how you can spread the word and use the results of the survey, and how EURORDIS members can use their own results. We will have a Q&A session, and we will then stop this webinar after a quick update on the upcoming Rare Barometer studies, which other survey results will be soon available, and the topic and the date of the next Rare Barometer survey. So to give you some context, I will let Gulcin introduce you to EURORDIS' work on newborn screening and participation in the Screen for Care project.
Okay, thank you, Jessie. Hi, everybody. So yeah, let's start with some background on our work on newborn screening. So as EURORDIS, we started focusing on newborn screening a couple of years ago. We first set up a working group and brought together many professionals from different backgrounds, including academics, clinical geneticists, newborn screening experts who are in their national screening committees, policymakers, directors of laboratory of newborn screening, psychologists, and of course, patient experts. You see that we have 35 members from 15 countries. And together with them, we look into the landscape of newborn screening in Europe. What are the disparities between countries, within countries, what the needs are. So, and then we started working on developing principles for harmonious adaptation of newborn screening programs across member states. And our aim was to improve outcomes for babies born with a rare disease and also their families. So in the next slide, you will see the document that we created. It includes 11 key principles on different aspects on newborn screening. I'm sure many of you have seen it, but the principles include how we should consider newborn screening as a system, not just as a test, but everything around it, such as collection of samples, inclusion of conditions, which conditions to screen, how should be the governance, the data protection, how the parents should be informed, how the staff should be educated, how we should include the ERNs in the system. And also the principles include the call to action that is targeted for decision-making bodies that are advocating for newborn screening in national, international, and also at the European level. And as you see, the principles document translated in 13 languages, thanks to our volunteers. And I think it's a very good way to use it in your advocacy purposes when you're working together with your national decision-making bodies in your countries. You can go to our website and download it. And I also want to say that during our work while creating this principles document, one concept stood out. The concept is actionability. It means that the newborn screening programs should screen for actionable conditions as well as treatable conditions. And why is this important for our community? It's because even if a condition doesn't have a current treatment, screening still can make a significant difference. First of all, to shorten the diagnostic odyssey, to give the family the option to be able to decide on the future pregnancies, but also because when the newborns have a diagnosis, they can get physical therapy, support in education, support in terms of economical support, or simply the family can make decisions to provide better care for their child, for their needs, and also from a broader perspective, when we do newborn screening for conditions that don't have a treatment yet, it would allow us to support research. We can diagnose individuals and then we can recruit them for clinical trials and find treatments for conditions that don't have a treatment at the moment. So I want to say here, our work in newborn screening is not only policy related, but we are also working on contributing to newborn screening research. And in the next slide, you will see how we contribute to research by the example of the Screen for Care project. So this project is a 5-year IMI project that started in 2021, and it aims on accelerating diagnosis through genetic newborn screening and artificial intelligence. And this project aims to do genetic newborn screening for 19,000 newborns in 4 countries, and through 2 different strategies. So one of them is the newborn screening in treatable rare diseases, and the other one is in actionable rare diseases. It's a big project. We have 35 partners in 14 countries. And as EURORDIS, we are a partner of this project. We're bringing in the patient expertise through different approaches. Let's go to the next slide, and I will explain more on how we do it, how we're involved. So we're involved in many tasks in this project, bringing the added value of the patients. We're giving input on the activities. What are its implications for rare disease community, and making sure that the project is patient-oriented, patient-focused, and we give advice on the project through different through our different groups. So we have the newborn screening working group, we have the newborn screening forum. We will explain a little bit more in the about the Rare Barometer survey, but we have a patient advisory board. We are a member of different boards, and we are organizing some focus groups within this project. So let's talk about the Rare Barometer a little bit, because we are developing and conducting the Rare Barometer survey by different approaches. So the Rare Barometer survey is one of the unique contributions that we add to the project. And I just want to give some context on how the survey contributes to the research project in general. So first of all, you'll see here at the first step, the results of the survey help us to define the actionability concept in detail. And then the survey results set the groundwork for discussions to define the criteria for choosing actionable conditions to screen newborns so that we can explore the feasibility of genetic newborn screening beyond treatable conditions. And then when both list of conditions are ready, the actionable conditions and the treatable conditions, the panels will be developed for clinical use. So we'll be able to offer the parents in this research project if they would like their babies to be screened for treatable conditions, and if they would like their babies to be screened for treatable and actionable conditions. So we're going to give them the choice. And in the end, we'll be able to evaluate the impact of genetic screening for both type of conditions. So that's it about Screen for Care. I'll give the floor to Rita to explain you a bit further.
Thank you so much, Gulcin. I would like to just very briefly give you some background information on Rare Barometer, on what we do and why we do it. So the Rare Barometer program is EURORDIS survey initiative. We were born back in 2016, and the overall goal of the Rare Barometer program is to collect the lived experiences, the needs, and the opinions of people living with a rare disease and of their family members in order to drive and support the evidence-based advocacy that we do at EURORDIS, but also to fuel the evidence-based advocacy of our member organizations, so of other rare disease patient organizations. And how do we do that? How do we collect these voices? Through surveys. We launch between 1 to 3 surveys per year. We now translate them and disseminate them in 25 different languages. We are very happy to announce that we have this year added to our pool of languages Ukrainian and Turkish. And also our surveys are open for worldwide participation. It means that anyone living with any rare disease or caring for someone who does, living anywhere in the world, can take part in our surveys. Also, up till now, we had up to 13,000 respondents completing at least one of our surveys. And to keep these numbers growing and make sure that we have a representative picture of what the rare disease community needs and wants, it is very important for us to keep growing and nurturing our panel, the Rare Barometer panel, which is currently made up of over 20,000 panelists, most of whom are people living with a rare disease. We now have over 2,300 rare diseases represented, as well as over 120 countries. But it is important to stress that you do not have to be a member of our panel to be able to take any of our surveys. However, if you are interested, it's quite simple. You just need to click or go to the link you can see here at the top of the slide. You're going to find a form there that you need to fill out. And really the advantage of becoming a Rare Barometer panel member is that you get first-hand access to information on any new upcoming surveys and also the results from previous surveys. And now I think you might be wondering, what do we do with all these voices, all this information that we collect? We also analyze it ourselves. And we then share the collective results with all the participants, patient organizations, decision makers, and the wider public. And something that is also very important to us and that we always need to and want to highlight is that data protection and privacy are of the utmost importance to us, especially because our community, due to the rarity of our conditions, this becomes even a more important topic. So we do have in place several measures and follow all the latest data protection and privacy legislations and regulations. And the information that the participants share with us is only accessible to our team, and it's also stored on a secured server based in Europe. And after giving you this very brief but hopefully informative overview of what our team does, I would give the floor again back to Jessie so that she could tell you more about this survey, the opinion of people living with rare diseases on newborn screening. Jessie.
Thank you, Rita. So just a quick overview of how this questionnaire that we used for the survey was designed and what it aims to do. So the reason why we did this survey was really what Gulcin described, which is that the work that was conducted by EURORDIS on newborn screening showed that we, in order to advocate for harmonized criteria and adequate policies for newborn screening in Europe, and to define a list of conditions to be tested in the Screen for Care project, we needed to better understand the attitudes and the perceptions of people living with a rare disease towards newborn screening for themselves, but also for all rare diseases. We also wanted to know which approach of newborn screening was considered acceptable by people living with a rare disease and how their opinion was linked to their own characteristics and to the characteristics of their rare disease. So the way we proceeded was that we conducted a literature review, which allowed us to go a bit further in the understanding of the concepts that we wanted to dig into, and that allowed us to identify the main criteria for newborn screening that we wanted to investigate in the survey, and also to have a more in-depth definition of what treatable and actionable means, so that again, we could investigate it more in depth in the survey. We also consulted 11 experts for them to provide inputs into which would be the priorities and the criteria for them on newborn screening. We worked with a topic expert committee who contributed to clarifying then the topics and criteria to include in the questionnaire. We then designed the questionnaire ourselves within the research team and provided it to the EURORDIS Council of National Alliances, who are made of patient organizations. So those are patient organizations representing several diseases in one country, so that they can also provide inputs on those topics and criteria and on the questionnaire itself, on the English version of the questionnaire. We then tested a pilot version of the questionnaire with people living with a rare disease and their family members. We translated it into 24 languages. So we had it translated by professional translators and had people from the community checking it in 15 languages to make sure that it was good and sound in their native language. And I will leave Fatoumata to present how many respondents we had before presenting the results of their answers.
Thank you, Jessie. So the survey took place last year between May 24th and July 23rd. As Rita mentioned earlier, the target population was all people living with rare disease and their family members. It was translated into 24 languages. And overall, we've had more than 6,000 respondents worldwide and more than 5,500 69 participants in respondents in Europe. Those respondents came from 50 countries and more than 1,300 rare diseases were represented. Next slide, please. As you can see here in the map, 60% of our respondents mostly came from Southern Europe and Western Europe, while around 20% of our respondents came from Northern Europe, and the least represented respondents came from Eastern and Central Europe, and represented around 11% of our respondents. So those numbers reflect the population size of those countries, but they also depended on the efforts put by patient networks in disseminating the survey at the national level in their country. So using the offer codes provided by respondents when they answer the survey and the classification of orphanet, those diseases, more than 1,000 diseases were classified using the therapeutic areas defined by orphanet. And we see that more than, and keeping in mind that one disease can belong to more than one therapeutic areas, we found that neurological disease and developmental anomalies during embryogenesis was the most represented disease or group of disease in the survey, while immunological disease was the least represented in the survey. And to obtain robust results, we only analyze with disease that have more than 30 respondents. So there are 20 diseases that had more than at least 30 respondents, and among which HHT was the most represented, followed by cystic fibrosis, and we had Rett syndrome and classical phenylketonuria that had the least 30 respondents. And if you have one of those diseases, know that the members organization can request the results if they have one of those 20 diseases. So I'm giving the floor back to JC.
Thank you. Yeah, so we do analyze the results of all of the diseases, but as you've seen, there are more than 1,300 diseases represented, and those ones are the most represented and those for which we can provide specific and tailored results. So it also means that we do have a wide range of rare diseases, because most of the rare diseases that we have may have 1 or 2 respondents per disease, which is not much for each disease, but which allows us to really represent a vast, a diverse range of the rare diseases. Just because I see the chat, I may just give some answer to Dan. So Dan, yes, one disease in the orphanet classification, one disease can be classified in several categories. So we just follow the classification as it was defined by orphanet and put what the disease is in the categories that are defined by orphanet. So yeah, one disease can belong to several therapeutic areas. So based on those results, what did we see? So you have here a quick summarize, a quick sum up of what we had in the questionnaire. So we had questions on some characteristics of the respondents and of their disease, and then we asked them if they would have liked to be diagnosed at birth, or the person they care for to be diagnosed at birth, which is how we collected the opinion of people living with a rare disease on newborn screening for their own disease. So as a proxy, let's say. We then asked them about their opinion on newborn screening for rare diseases in general. So not only their own rare disease, or if they would have liked to be diagnosed at birth, but really if they think that it would be a good thing to have newborn screening for all rare diseases. And we asked them with some criteria. So we asked them if they thought that it was a good idea to screen newborns, depending on the treatments available, on the prevalence of the disease, so if it's more or less rare, on the age of onset, which is when the symptoms typically appear, the age at which the symptoms typically appear, the severity of the disease, if it's more or less severe, and the penetrance of the diagnostic tests, which is the chance of false positives or the chance of the patient or the child to actually develop the symptoms of the disease if the diagnostic tests are positive. And we also, to go deeper into the definition of actionability, we defined a list of reasons to screen for diseases that have no treatment. And we asked them if they thought that we should screen rare diseases, any rare disease, depending on those criteria. And we also asked them two open questions, one on the benefits of newborn screening and one on the harms of newborn screening, in their opinion, for the rare disease community, for the newborns, for their family, and also for the wider society. So the quotes that you will see are coming from the respondents in their answer to those open questions. So first of all, let's have a look at the respondents' attitude towards newborn screening for their own rare disease. So as I said, what we did was that we asked the question to people living with a rare disease, and the way it was phrased was, if it is or were possible, would you have liked to be diagnosed at birth? And when respondents were family members of people living with a rare disease, we asked them if they would have liked the person they care for to be diagnosed at birth. And one first result is that, as you can see here, people living with a rare disease represent 46% of our respondents, which is quite low compared to our usual repartition in Rare Barometer surveys, which is usually 2/3 of people living with a rare disease and 1/3 of family members. So that's already a first result showing that newborn screening seems to be a topic that is of particular interest for family members and especially for parents, because we mostly have within family members, we have close to half the sample, which is composed of parents of people living with a rare disease. And so there was those two propositions, those two sentences that were given to the respondents, and they had to say if they strongly agreed, neither agreed nor disagreed, or strongly disagreed with those two sentences. And the results are that if we take all the respondents, so people living with a rare disease and their family members, 73% agreed or strongly agreed with this proposition. So it means that we have a wide majority of respondents who would have liked their rare disease to be diagnosed at birth. And in comparison, we looked at the existing studies because, as you know, Rare Barometer is really there to survey only the rare disease community. So we don't have the means, and we're not here to survey the general population, but we wanted to be able to compare with studies that were on the general population, so that we can have an idea of what people from the general public, who will be the ones who will be who can have their children, their newborn screened as part of newborn screening programs. So we still wanted to compare, and what we found was, for instance, in one study that took place in the UK on spinal muscular atrophy, because we had to take specific rare diseases or just specific countries, because there was no survey on the general population in Europe, that would be Europe-wide, on opinion on newborn screening. And what we saw was that in most of the studies that we found, actually people from the general public were more in favor of newborn screening than people living with a rare disease or their family members. And that was the case in that study, where there were 84% of people from the general public in favor of newborn screening for spinal muscular atrophy, against 70% of people living with spinal muscular atrophy and their family members. And we wanted to go a bit deeper and still have a look, because it's really not the same to answer to this question whether you are living with a rare disease yourself or just having a child that has a rare disease, and we'll get a bit deeper into that later on. But we wanted to see the difference between the responses from the parents and from people living with a rare disease themselves. And you see that parents are even more in favor of newborn screening. 82% of them agreed or strongly agreed that they would have liked their child to be diagnosed at birth. And just to give you again, a comparison on hemophilia in the UK. Again, a study also showed that parents were more in favor of newborn screening for hemophilia than people living with the condition, adults living with the condition. And we will also explain some reasons for those differences a bit later. So one reason that could explain this strong support for newborn screening from parents of people living with a rare disease. So the best way to explain that is really for you to listen to the testimony from Iuliana Dumitriu that she gave for a Rare Runner podcast. So that's really an extensive interview. And she describes what it took for her son to have a diagnosis for Coffin-Lowry syndrome. So from the very first days of his life, after just 10 days, she was advised by the medical team that he should have physiotherapy because they saw that something was wrong. So they went to physiotherapy, they went to several consultations every other month with their son to make sure that he develops properly and normally, let's say. And then after 3 years of daily physiotherapy, they had a development, a cognitive and physical development assessment. And they realized that the results were that he was 30% in the development compared to his peers. So he was developed only 30% compared to what was considered normal for a 3 years old. And that was a shock because they did spend every day in physical therapy, a lot of energy, and in the end, something was wrong. This is also when she decided to look for a diagnosis, to look for what her son could have. And it's only through research, online research, that she came across the name of the Coffin-Lowry syndrome. That was something she felt her son could have. But she also tells us in this testimony that it was also such a shock to realize online that he could have such a severe disease that she just put that aside, that she was in denial for a year until he was 4 years old and his front teeth fell down, and which was too early for 4 years old and a sign of Coffin-Lowry syndrome. So it's only then that she contacted a patient organization for Coffin-Lowry syndrome, and that she had the confirmation, what she considers as a confirmation from the president of this organization, that this could be Coffin-Lowry syndrome. And then to confirm the diagnosis, it took another 3 years, and a medical team in France. So she lives in Romania, and that's a clinical team in France that had the right medical equipment for to run the tests, that could confirm the tests and which mutation her son had, so that she could adapt the treatments and the care that he could receive. So just to tell you that, of course, parents of children living with the rare disease are in favor of newborn screening because they see that if the diagnosis was given at an early stage, and if it was possible to have the name of the disease and to have the disease diagnosed early through newborn screening, this would avoid, for instance, in that case, 7 years of searching for a diagnosis, of denying the symptoms and having to go, because she had to go through the emotional process of accepting the disease of her child on her own because she saw the diagnosis just online. Then when we ask to people living with a rare disease themselves if they would have liked to be diagnosed at birth, we have fewer of them who say yes. But this is also based on a different profile. So not all of them had to go through a very long process of diagnosis. First of all, not all of them have a disease with a pediatric onset. And when we ask them if they would have liked to be diagnosed at birth, 63% of them say yes. And in the 16%, it's still only 16% who said they would not have liked to be diagnosed at birth. The 20 remaining percent said that they didn't have an opinion. For them, it's mostly people who have late onset diseases, who have diseases that are not genetic most of the time, well, more often at least. And also they tell us that they are more afraid of the consequences that early diagnosis could have had on their life. Some of them even told us that actually what they wouldn't have liked would be to have a rare disease, were the consequences of the rare disease. So someone told us, for instance, that they would have preferred not to have a rare disease so that their siblings could have more attention from their parents. So sometimes also when we ask people about their own experience, they can also relate to the difficulty of having a rare disease more than of being diagnosed earlier. And actually what we see is that more of the people living with a rare disease told us that they would have liked to be diagnosed at birth when their disease has an early onset. So when it usually appears before or during infancy, when the rare disease is genetic, when it took very long to be diagnosed, when they had a diagnosis, let's say, of more than 5 years, and also when their symptoms of the rare disease are improving. So for instance, someone told us that knowing about the genetic predisposition to a particular disease, you can notice the first symptoms in a timely manner and adjust your lifestyle or treatment to avoid transition to more severe forms. But the diagnosis was made late after 10 years of incorrect and ineffective treatment. And due to late diagnosis, I lost a lot of my quality of life, which I never managed to restore. With timely diagnosis, I could be living a full life. We also saw, and we cannot completely explain those results. So, but this is more and more what we can see through Rare Barometer surveys, which are most of the time the only evidence that the only European-wide evidence that we have on the experience or the opinion of people living with a rare disease is that there are some geographical differences that we cannot always completely explain. So one of those is here that we see a difference in the opinion of people living with a rare disease depending on the country where they live. And people from Eastern, Southern, and Central Europe are more in favor, or more of them would have liked to be diagnosed at birth than people living in Northern and Western Europe. So there could be cultural differences. There could be differences that are linked to the healthcare system or the society and what it can provide after being diagnosed, but we cannot really explain completely those differences. And another unexpected result is that, so we asked respondents if they have access or if the patient has access to a treatment. So we know that very few rare diseases have an available treatment. The percentages are 5 to 6% of the rare diseases, not of the patients, but or of the people, but 5 to 6% of the rare diseases have an available treatment. And actually, this had no impact, the availability of treatment or the actual access to a treatment from the respondents on their willingness to have been diagnosed at birth. So it's not significant statistically, and this really relates to what Gulcin was talking about the actionability concept that was developed through the newborn screening when working on the newborn screening principles, that what people living with a rare disease tell us is that regardless of available treatment, what they think is that a diagnosis is important because it allows to better understand what is happening to them. And that's often indispensable to receive reasonable medical care or help in their everyday life. Now to go a bit further, because to know more about the criteria that seem to be acceptable or that are acceptable for people living with a rare disease, we ask them about their opinion on newborn screening for any rare disease. So in a way, we put them in the same situation as someone with no rare disease and with no knowledge on a rare disease and for whom we would ask their opinion on newborn screening for rare diseases. So when we survey the general population, if we surveyed the general population on newborn screening, they would have no knowledge of the rare diseases. And this is the type of situation where we had put our respondents, because we didn't ask them to give us a better understanding of their experience, but more to give them their opinion on all rare diseases that they cannot know. They just have their experience of their own disease, but not of the more than 6,000 rare diseases. So one question that we didn't include in this survey, because we already included it in a previous survey that was on the part of the Rare 2030 study, which was a prospective study on what we should advocate for rare diseases for 2030, was that 95% of the rare disease community, or 95% of the respondents to this survey, supported newborn screening for rare conditions in general. So we saw through the survey that there was a wide acceptance of the principle of newborn screening for all rare conditions in general among the rare disease community. So you still have access to the results of this survey. You have the link here. We could maybe share it in the chat, but this is really one of the results of this survey. So we went further. And first of all, I would like to, before going to the criteria, and this will also help us to understand a bit their opinion on the criteria for newborn screening. We asked them about what, in their opinion, could be the consequences of newborn screening for any rare disease. So a wide majority of them told us that it could be empowering to the family, and only 12% said that it would not be empowering to the family. The other 20%, again, had no opinion. But we also had 61% who said that it could cause anxiety for the parents. And this is not antinomic, because we have actually 42% who gave the two answers, who said that it could be empowering to the family and cause anxiety for the parents. So what we had also into the quotes that we had into the answers to the open questions were people saying that, yes, there is anxiety anyway when you receive the diagnosis of a rare disease, but then the access to the information that you gain outweighs the anxiety that is linked to the fact that you receive a diagnosis for a rare disease. And then only a minority of respondents told us that this could lead to discrimination and that could create stigma for the family. And on the criteria, so this is quite a big slide, but I wanted to give all those figures because I think they're quite important. So there is a lot of information here. First of all, the list of criteria that we had. Second of all, the way we define them quite precisely so that we could ask questions that would be as precise and understandable as possible. Then you have the order in which they appear. Those criteria is not just by chance. Actually, if you look at the different percentages in line, for instance, for severity, you see that severity has the biggest difference between the criteria of people who think that we should screen for very severe diseases And those who think that we should also screen for diseases that are not severe. So it is, let's say, the criteria that impacts respondents' opinion the most, because it's the one that has the most difference between the two, the most and the least chosen item, the most and the least chosen modality. So 90%, close to 90% of the respondents thought that we should screen rare diseases. There should be newborn screening for rare diseases that are mostly severe, which was defined as life-threatening or leading to severe disabilities. And 52%, so you can also notice, and that's another result in this slide, that even the least chosen criteria have been chosen by a majority of the respondents, which doesn't mean that we should screen for diseases that are not severe. It just means that there is wide acceptance still in the rare disease community for newborn screening of rare diseases. So 52% of the respondents thought that rare diseases that are not severe should be screened, and that was defined as diseases that only have a marginal effect on one's health and quality of life. Penetrance, so how much tests, positive diagnostic tests allow to say if the symptoms will appear. 84% of the respondents thought that if diagnostic test is positive, or we should screen, for rare diseases for which there are 80% chances that the disease appear if the diagnostic test is positive. And 53% of the respondents said that for a low penetrance of the diagnostic test, when there is a low penetrance of the diagnostic test, we should screen newborns for this disease. Age of onset is also quite important. So 83% think that we should screen newborns for diseases that have an infancy onset, and 62% for adult onset conditions. Treatability, so 84% think that we should screen diseases through newborn screening programs or at birth if there is a treatment or intervention available that could lessen or control the effects of the rare disease. And 69% think that we should screen rare diseases even in the absence of such treatments and interventions. And the prevalence doesn't really impact the opinion of people living with a rare disease, because there is just a 4 percentage points, difference between the most prevalent and the least prevalent rare diseases. So just to compare with what we can compare with the evidence that we have available on this topic, in the same survey that I already mentioned, so the survey that we did with the Rare 2030 prospective study, we also asked respondents if they thought that we should, well, first of all, we informed them that many countries had developed compulsory health programs to test newborns and diagnose rare diseases at an early stage. And we phrased the question a bit differently, because we did not yet do the whole conceptual search and definition that we did for this survey. But still, we see that this confirms the results of our survey on newborn screening regarding the treatable diseases and the actionable diseases. So 80% of the respondents of the Rare 2030 survey said that they thought that we should screen for diseases that are treatable, and 70% for diseases that are actionable. So this is really close to the results that we had in our new survey. And finally, I won't go in depth into the list of criteria that we had to define actionability. So we had 13 criteria. They are all listed into the report that is available online. But just to let you know, because this is also one important result, which also tells us in this instance that the way we ask people, the way we phrase our questions, and how detailed we are in the way we ask people about their opinion really has an impact on what they will tell us. So what we wanted to do was to be able to define a bit better the concept of actionability and see which criteria for actionability were more accepted by people living with rare disease. So one result that is not in this slide, but that you can see in the report, is that so for all of the 13 criteria for actionability that we had listed in the questionnaire, the least chosen one was still chosen by 73% of the respondents. So it means that even those who would not have liked to be diagnosed at birth, and even those who said that they didn't think that we should screen for diseases that don't have a that don't have a treatment, when we defined a bit better what actionability could mean, and for instance, that it could allow to have access to a quicker diagnosis, that it could allow the person living with a rare disease to have their disabilities better recognized, more adequate social support and independent living, or that it could allow the disease to be followed up and harm to be avoided through prevention practices, and again, even in the absence of a treatment, then 90% of the respondents then said that they thought that we should screen rare diseases if this could allow to have access to quicker diagnosis, have disabilities better recognized, and access follow-up care and avoid harm. So this not only gives us more information on the acceptability of those criteria, on the opinion of people living with a rare disease, but also on the importance to really define what it means to screen for actionable conditions, or to what could be the consequences of newborn screening when we ask people about on their opinion on newborn screening. And one comparison, because again, in that instance, as I said, we put people living with a rare disease in the same conditions as anyone from the general population being asked about newborn screening. And in a study that was conducted in 2012, or at least published in 2012, on the prospective parents and the general public in Canada, there were also more people from the general population who agreed that testing should be available for parents who wished it, even when they would have declined it for their own newborns. So we can see that there is a wide acceptance of newborn screening in general. And again, when people are just faced with a choice, they also tend to say that or less willing sometimes to have newborn screening, maybe for specific reasons, like we saw for the answers from the people living with the rare disease that we had in the first part of this presentation. So before going to the questions and answers and answering, or maybe discussing also all the questions that you added in the chat, because some of the questions I saw while presenting were about the availability of those results and how you can access them. So I will get back, give the floor back to Rita to present you how you can access those results and who has access to which results.
Thank you, Jessie. And from many comments we have been receiving in the chat, we can see that many of you are intrigued and interested in getting the results. And for some minutes now, we can put all these interesting numbers aside and focus on how you can have access to the results later on. So we do provide tailored results to our EURORDIS members, and also now more recently, we also share tailored results with the European reference networks, the RNs. So we share collective results, provided that a respondent's anonymity is ensured. This means that, for example, we share European or international results for a rare disease or a group of rare diseases with our European and international federations. So you can see column 1, row 1, but only when we have at least 30 respondents. We can also offer country-specific results to whom our national alliances, so have a look at the second column, second row, we can share the results for one country, so all the rare diseases represented in a single country. And because our membership is quite diverse in terms of size, but also scope, and we have members that, for example, represent a specific disease in a specific country, we can also share tailored results with them, again, when we can ensure that the privacy of the respondents is guaranteed, so when we have at least 30 respondents. The same holds true for their EURNs, and like I told you, we have just very recently, this is a newer and closer collaboration that we have established with the EURNs. We have started sharing tailored results with them. We have been working with different coordination teams and with the EPAC advocates, so the patient representatives involved in the EURNs, to develop and validate a list of diseases so that we can share with them the European results for those diseases, so the diseases that each of the EURN covers and actively works on. And what about the European results? Anyone and everyone can have access to our European results. We make them freely and openly available on our EURORDIS website. And maybe you are thinking, how do we make them available? I know some of you have already asked about that in the chat. Well, we make them available in at least 3 different formats. The first one is a report, which is the most comprehensive and extensive format we publish our results in, at least for this newborn screening survey, and we only make it available in English. You're going to be able to access it in the link that you see here at the bottom of the slide. But in addition to the report, we also publish our results in shorter, more condensed and more visual formats. Here you can see 2 examples of fact sheets. We have a longer version that has a total of 4 pages that we will also only be making available in English, but we have shorter fact sheets, no longer than 2 pages, that we are going to publish in 15 different languages, and we will be able to translate it or translate them in additional languages, on demand. And you will also be able to access those on our website. And we are also going to publish the European results using the dashboard format. So you can see that it is also a very visual format. It's also detailed and comprehensive. So we're going to, in the dashboards, you can have access to the results for each question in the format of tables and or graphs. As you can see here, you're going to be able to access descriptive statistics for each of the questions. The dashboard is going to have 30 pages, and we're going to be providing these in 24 different languages. We are also going to be talking about these results at the upcoming European Conference on Rare Diseases and Orphan Products that is taking place on the 15th and 16th of May. This year, it is going to be a fully hybrid event, and we have a session entitled The Path Forward for Equitable Diagnosis, where we will be presenting the results of the survey, but also the results of a survey we conducted also last year on the diagnosis journey of people living with a rare disease. And going back to the tailored results to our EURORDIS members, there is another save the date we want to share with you. This time it's May 17th, because this is the day when we will start sending out tailored results to our members. So we can offer all our members fact sheets that we can tweak and adapt to include the results of your country, for instance, or of your rare disease or group of rare diseases, again, when we have at least 30 respondents for that disease or country. And here you can see on the screen an example of what a fact sheet looks like. And also, in addition to the tailored fact sheets, we can also send you tailored online dashboards. Again, this is just an example of how the dashboard for the results of the newborn screening survey is going to look like. You can have access to the graphs and tables, and also we offer the possibility to filter crossings so you can really play a little bit with the results and better understand the results for your community, your disease, and your country. And like I said, the dashboards are made available. We make them available in 24 different languages. So feel free to reach out to us if you're interested in getting your tailored results. Please drop us an email to our email address at rarebarometer@eurordis.org. We, by default, send the results to our national alliances and the European federations, but we do need some specifics, some information so that we can share the results that are the most meaningful to you. So, for example, if you are a national alliance, of course, we're going to have to know the name of the country, the languages in which you need the results. And for example, for the dashboards, we would like to know the format in which you would like to access the results. If you are a representative of a European federation or an ERN, we would need the list of the orthocodes so that we know which diseases to include in the dashboard of results, the language or languages in which you would like to access the dashboard, as well as the format. And finally, for all other EURORDIS members, we will need the countries and the dashboards, in addition to the languages and to the format of the dashboard. So now I would give the floor, I believe, to Jessica, right?
Thank you, Rita. So regarding the dissemination or the use of your results, we will not be providing a communications toolkit. I know somebody asked in the chat if we were providing visuals. We are not, but please, these are your results, European results or community results in the case of our members. So these are things that you can use to populate your social media or your outputs and communications in general. If so, we do encourage you to please use the hashtags Rare Barometer and Screen for Care so that we're able to see what you share and on which platforms. It will be very, very helpful. And feel free to use the fact sheets. So they were made visually appealing on purpose for it to be very easy to disseminate and to share amongst your networks. You can also, as Rita said, tweak the dashboards to see the results of your community or specific results. You can use the elements from that to promote certain, let's say, events. For example, Newborn Screening Awareness Month is in September. You can use the elements from these results to help you in supporting those campaigns. Other than that, we do invite you to, as it says, repost, reshare, retweet any content that might be coming from our accounts. So it is at EURORDIS on Facebook, Instagram, Twitter, and LinkedIn. Please feel free to these elements, and you can add your organization's logo upon request on the fact sheets for the case of our members. In regards to our member results, these will be available to use, as Rita said, on the 17th. With the possibility of adding a logo and available in either the 15 languages or other languages upon request. And those can be used in your publications. But again, we do invite you to include reference of Rare Barometer and Screen for Care, and to contact us with these requests. For example, to mention the logos, you would have to contact us to send over your logo so we can edit that for you. And in the case of if you do not receive enough respondents for the survey results, it's unfortunate, but it is not the only surveys that we do. Rare Barometer runs about 1 to 3 surveys a year. We have other surveys happening, for example, which we'll talk about a little bit later. So keep up to date, encourage your participants or your networks to register to keep track of these surveys and these results. And you can find the link in the chat. I will repost it right after this, a link to our page so you can be able to register and keep track of future surveys. For survey launches, we do provide usually toolkits so you can promote that. We do encourage you to do that very vigorously. So share on social media, share amongst your networks, post visuals if need be. And we do provide translations to make it very easy for you to share this so you can have the necessary number of respondents to have your results at the end of this journey. So
we just give some examples in the PowerPoint in the presentation, but we will send you this presentation later on of how some members have already used their results. But I think maybe we can now go to the questions and answer. So maybe if my colleagues have seen some answers in the chat that would be worth addressing, or comments that we could discuss, we have kept some time for that.
Yes, we got a question from Jennifer Jones asking us if in our results we could identify two defined groups, one that is always against newborn screening and another group which sits on the opposite end of the spectrum and who is always in favor of newborn screening regardless of the criteria or circumstances.
So there are some, yes, and we didn't specifically do a statistical analysis on those two groups because actually when we looked at the results and started to do analysis, a group analysis, we just had the same results as the one that I just presented, which are more people were people from the group who is for newborn screening, let's say, were more willing to have been screened at birth or had more of the time adult onset childhood onset conditions, genetic diseases, etc. So parents were also part of the group that would be for newborn screening. So that really relates to the characteristics that we have shown. It's really the same thing. So we just kept one type of statistical analysis, which is also easier to translate into dashboards and for you to use because we could not provide our members with a group analysis like we do for crossings. So it really relates to the first part of the presentation of the results.
And then we also had a question. I'm sorry, but I don't remember who asked it. But it's more on how these results are going to be used, how they are going to be leveraged to advocate for newborn screening at a European level.
Yes, maybe Gulcin.
Yeah, thanks for the question. So yeah, I think the results of this survey will not only help us within the Screen for Care project, but our work is still not done. It will help us also in terms of our policy work. Now we have the evidence that people living with rare diseases are supporting newborn screening. We can focus on newborn screening harmonization for joint action, to call for a joint action on newborn screening. I think both by focusing on newborn screening advocacy and also research on newborn screening, I think we have like a couple of points where we can move forward. So we can promote more health economic studies because we need to convince the health authorities that the cost of newborn screening is not only the cost of the test. We know that it's also saving the paying bodies from the cost of multiple visits to doctors, diagnostic tests, misdiagnosis, visit to emergency rooms, physical therapy, rehabilitation. So we can make compelling cases for expanding newborn screening in member states. And we can work on the newborn screening advocacy from that point of view. But also we can support more pilot studies and push for data sharing. And that not only the countries that have the pilot studies will do these studies, but also we can repeat those studies when discussing whether disease should be included in the newborn screening program, and also learn from the countries who have done those studies. We can also promote the newborn screening policy by including more patient voice in more research studies. So it will help us to shape the future of newborn screening and kind of transmit what is important to us and improve diagnosis and delivery of diagnosis, so we can promote also this in our policy work at the EU level.
And maybe because the question is related to that, we have a question from Patricia also asking if you think this impact can be borderless. So if we can also influence policies and the number of diseases being screened at birth globally, so not only at the European level.
Yeah, of course, because I mean, we know that the newborn screening is a national health issue, but also research studies in general, they're a big step for driving change, because they lay the groundwork for different clinical practices. So when we evaluate the feasibility of different practices, we can implement them in different settings for different conditions in different countries. So I think once we focus on the research studies, we can help improve newborn screening practices globally as well.
Thank you, Gulcin. And maybe now we could move to a question from Anne, who said, what is severe? What is life-limiting? And who decides what is severe? Before 22q diagnosis, I was told my child was, and I quote, mildly mentally retarded. So mild in comparison to what? Something worse? So I guess Anne's question is about comparing levels of severity, or why we should not do that, and if we shouldn't be looking closely at the needs and asking the families what matters to you, if that isn't more important and informative.
Thank you. And I see that there were questions on also the detailed results. So maybe there are two parts in this question, actually, because we did say that so a report, a 30 pages long report, will be available on the website, the web page where we have all the results gathered. So this will go in depth really into the results. And because there is a question from Eva asking if there would be an article aside from the graphs. So I don't know if you were referring to this type of report, but if you're thinking about a peer-reviewed article, we don't have one planned yet. But then it would be for the EURORDIS management and board to decide if we can use the results for a peer-reviewed article, like we did for the diagnosis survey. Do you see any other question, Rita, that we could address?
No, I think let me just double check. No, I think we have covered all of them.
Then maybe I can leave the floor to Fatoumata to talk about the upcoming results and new surveys.
Thank you, Jessie. So we are happy to announce you that the European results for the diagnosis study will be available on May, with a publication that will come early May. And the fact sheet will be available, 2-page European fact sheet, translated into 25 languages, and you will always have also have access to the dashboard, European dashboard, that will be available in 27 languages. So you have here the link that you could use in May to access those resources. And the results will be discussed during the ECRD, as well as the newborn screening results. And if we have a session that will be dedicated to the result of the diagnosis, it is a path to a forward for equitable diagnosis it will be on May 16th at 11:30 p.m. So you can still use the code bar to get the 15% off registration, online registration to attend the presentation. And lastly, we are happy also to announce that we have an upcoming survey that will be on social participation and independent living. So as we mentioned earlier, get ready by registering to the Rare Barometer panel to be the first one to receive the questionnaire, and also the first one to receive the results of the survey when the survey closed. You can use the link that is in the chat to register to the Rare Barometer. Again, you do not have to register to receive the to be able to participate in the survey, but it is still useful to keep track and to be able to get the results, to be able to receive the results first. And what you can do to promote the survey is to talk about it on your platforms. You will have a communication toolkit that will be available in 25 languages to help us promote the survey in your community. And this survey, this communication toolkit will include social media templates, visual cards, and hashtags that you can use. And to just add a comment about the comment that Anne made earlier, not about the severity, but more about the need of patient, it will be a good opportunity to participate in the survey. We are going to address topics such as personal assistant, disability assessment, and disability itself. So yeah, feel free to participate in the survey and to talk about it around you. Thank you.
Sorry, I didn't unmute myself. Thank you to all the participants, to all the Rare Barometer participants, but also to the participants in the webinar. We were quite a lot. Thank you very much for your questions, for your interest. And we will send you the presentation and all the links by email, not only to you, but also to those who registered without attending. So thank you again. Please don't hesitate to reach out to us. You can write to us at rare.barometer@eurodis.org for any question. And we will be happy to answer those or to send you your own results. Thank you very much.